Okay, let's get this. This crowd seems ready to ask some questions. Wow.
All right.
Okay. Good luck with that, Caitlin.
Thank you. Hi, my name is Jill Carpenter, and my Twitter handles are @PTSDinfo and @JCarpenterClicks. The president spoke a lot about progress that's been made, and there has been a lot of progress made, but there's some areas where progress hasn't been made. And my question relates to how, as a nation, can we become more effective in treating mental illness and suicide prevention? The head of the Massachusetts VA has said that by the time you call our suicide hotline, we have failed.
Yeah.
Currently the primary treatment for depression works less than half the time. And people commit suicide because they lose hope, basically. Walter Reed is about to start a trial where they're going to test some new technology that gets people on the best meds faster and has 2 to 3 times better outcomes than current best practices. How do we get that information out to those people? How do we give people hope that the soldiers who are coming home, that they're going to be well taken care of and that their mental health will be just as important as their physical health?
Great.
Thank you.
So I think there's 2 parts to that. I think the mental health and then perhaps some on focus on the military. But Sarah, if you want to talk a little bit about.
Sure, it's an unbelievably important issue, and I had the honor to serve in the Clinton-Gore White House and participated in 1999 on a White House conference on mental health, and it is unbelievable coming back to it this many years later. Progress has been made in terms of people's awareness, but not as fast as it should be. And it is something that this administration has taken very seriously since day one. One of the most important things, in my view, that we will do for mental health in this country is the Affordable Care Act. It will enhance at least access to treatment, which is obviously, you've highlighted many of the different issues that are at stake here, but certainly offering people coverage. And one of the things that we put out in the gun plan was making sure that the mental health parity regulations go final, that our Affordable Care Act is very clear in what we expect on coverage from our insurance companies, and as well as Medicaid, which is actually the largest provider of mental health in the country. We're very clear to providers. So that was very important. We also had a number of different sort of public health programs that get at some of the issues, proposals that you talked about in terms of more mental health counselors, more awareness in schools, just sort of, there's a promising kind of thing of just, it's sort of a mental health first aid, in that, you don't have to teach every teacher to know exactly, they're not going to be a mental health expert, but you can kind of teach sort of basic, just like we all get taught first aid and sort of basic CPR, like sort of what's basic things to look for and signs and who you're supposed to call and all that kind of stuff. And then one thing I'm very excited about is Secretary Sebelius and Secretary Duncan are going to be launching a mental health dialogue in the coming weeks to really spread awareness, to know what to look for in our in our friends and our communities and our teachers. And we're going to be asking a lot of different private sector commitments. We'd like to involve young people as well, and the online community, and really everybody, because we know 16 to 25-year-olds, that's the most common age when you get a mental health instance arises. It's not a time in life when people are great at finding people to seek treatment. So we need to kind of bridge that gap a little bit, and we're going to try to do that and a whole host of other things. But I appreciate the question. It's an unbelievably important question, and it's something we're super focused on here at the White House.
I'll just add briefly to that. My mom is actually a psychologist, and this is a question that she asks of me quite a bit, so I'm sure she'd be heartened by your answer. I will. I always do. As she can attest, as she's probably watching. But on veterans, the one thing I did wanted to say is that was actually one of the heartening things that I did see during the speech, is one of the moments in which both sides of the room did appear to stand up and applaud the president was when he talked about caring for our veterans when they return home. This is obviously something that's been a big priority of the First Ladies and Dr. Biden's. This is something that is at the top of their agenda. This is also one of the reasons that it's so important what the president has done in terms of ending the war in Iraq and bringing our troops home from Afghanistan. There's no question that repeated deployments have taken a real toll on the best that our country has to offer and their families. And that certainly is another benefit of doing that. And the last thing I'll say is that the president, as you've all have seen, has nominated Senator Hagel to be the next Secretary of Defense. Secretary Hagel, when he's confirmed, will be the first person of enlisted rank to serve as a Secretary of Defense. So this is somebody who served in Vietnam, who has 2 Purple Hearts. He is somebody who firsthand is aware of the strain of serving this country on the battlefield. And I know that the President has already talked to him, and the one thing that they agree on is that caring for our veterans when they return home is a top priority, including making sure they're getting access to the mental health care they may need when they return home.
So I wanted to just give you guys a quick update.